Hey everyone, good morning. It's me again. No. If you were on my Facebook page for Rise Chiropractic just a few minutes ago, I was with somebody that does not look like this, Miss Maya, but it's Dr. Christina and Dr. DeBoer here.
I was just a busy lady.
Yeah, right. Hey, I only had a short time frame, and so do you ladies. So we get it done, right? All right. So we're already on video number, I think 4. Is this 4 or 5? 4. Yeah. 4.
A whole month of videos.
I know, right? Dang, commitment. New Year's resolution. I maybe made one, right? Okay. But anyways, we are going to talk to you guys about
Diastasis Recti.
Yes.
Also known as mommy tummy.
Yes, or DR for really short. If you ever see DR or DRA, some will refer to it also. So we're going to talk about what the heck is it, what it maybe looks like in your body, and how you would know you have it or how you would treat it to get rid of it, right? Because I'm sure you have seen, like I have seen, there is a lot of buzz on the internet and everywhere else about DR, and that it's almost this super scary thing, I think. I feel like, you know,
for sure.
Literally, I've been in practice now for almost 10 years, and I really feel it's like maybe the last 3 years that patients are like, can you check me? Never before would I ever be asked. I check them. They don't know what I was checking for unless they had it, and then I would tell them,
right?
You know, but for sure, I've had a lot more patients like, can you check me? You know, and I'm like, okay, sure. Yeah. But
right.
yeah, so Dr. Christina, I will hold the awesome visual that I drew.
Yes.
And she's going to explain what DR is. All right. So if you don't see my face for a little bit, just me holding my thing.
So I love that.
I'm back here sleeping.
So what DR is it's a separation of your six-pack abs. So your top layer of abdominals are sort of your six-pack or your rectus abdominis. And it's drawn kind of here. So what we have is your spine, I think.
Ribs.
Oh, ribs, sternum. Yes, of course.
Got it.
Then
it's a little bit crooked. Come on. Hand drawn.
And if you can imagine lines drawn across and down the middle, like a six-pack of Coke or beer or whatever it is you're drinking 6 packs of, the middle of it,
sparkling water,
right, gets split when you have a baby. So baby grows, baby has to come out, right? So there needs to be room for it.
Right. It also does grow in like beer bellies. Yeah. So it's not just pregnant ladies that can get the separation. Any kind of that.
Oh no.
Bigger abdominal for sure can get it too,
I've seen DR in a lot of like older men with you know, that sort of round stomach.
Yes, me too.
And they never worry about it. It like never concerns them. They never talk about it.
No. But it concerns us.
Yes.
100%, and we'll tell you why. Yeah.
So that you have connective tissue that runs in between the linea alba, and it ends up stretching, and that's totally normal. There's research that says that up to 100% of women during pregnancy will get diastasis recti, which is literally just the spreading of the abdominals and the spreading of the linea alba, which would run right down here.
Right, the little dot's your belly button.
Yeah. So if you had a six-pack, which I personally do not, but if you had one, you would see the dividing line like right here.
Yeah.
So what will then happen is that after you deliver, that split can sort of stay. And so in the medical world, we all check it with our fingers to see how wide the split is. What we're finding, though, that's really interesting that the research is coming out now, is that we care far more about how deep maybe the separation is, like what your ability to use your abdominals are, not just your six-pack abs, but the very, very deep layer of abdominals called your transverse abdominis,
right,
or your TA. So you can have a very wide split, but still have it actually be really functional, and it can be not a big deal. You can also have a really tiny split and not be able to access control, and that can set you up for kind of a longer term issue.
Right, 100%. Yeah. So a check for DR is all external. You're gonna lay on your back, bend your knees, engage your neck at some point, and it's literally just the practitioner feeling down that center of your abs. And that's like Dr. Christina said, you know, they might say, oh, a finger, or it's 3 fingers, or it's fist, you know, like they might mention that. A good practitioner will at least mention it, and maybe how deep approximately, or show the patient so you can kind of see, right? The lifting of the neck engages the abs, so it will say, you know, like when you're engaging, right, of does it come closer together or does it not? You know, all of that is very valuable to a practitioner. So the check itself is easy, to say the least, and non-invasive, 100%.
Sure.
And like Dr. Christina said, that everybody in pregnancy is gonna have the separation, and 100% it's postpartum, you know? You definitely want to, I'm gonna put this in.
Yeah,
I'll put it in. You definitely want to work on it regardless of, you know, how deep, how wide, for sure. You want to get that functional ability back, but 100%, just because you have a 3 finger wide and a finger and a half deep or whatever DR does not mean like the world's gonna end. I guess is basically what I'm trying to say.
Yeah, so if you have one, don't panic. If someone's told you have one, don't panic. Again, kind of to Ashley's point earlier, like DR has gotten like a really bad reputation in a pretty recent time frame, but it really doesn't have to be some big scary thing.
And the treatment is not scary.
No,
either,
it's really not.
Like, and the treatment, you know, yes, it's gonna take some work on your part, you know, and stuff like that, but it doesn't mean that, you know, it's a lifelong thing or anything like that.
So this is why we care about DR. It's because if you're getting, and the way that you might know if you have DR, and you can see this.
How are we gonna know?
You can see it when you're pregnant or postpartum. Is if you go to do. Some people will say like, oh, I went to sit up in bed, or I went to do my normal exercise, whether that was on a bar or doing a sit up or whatever it is. They're like, I got this weird like alien doming.
It's not the baby.
It's not.
No.
But so if you look down while you're doing one of those things and you see like a dome right here, it just means that you're not regulating your intra-abdominal pressure well. And so that pressure is going through the point of least resistance, which is now that diastasis recti.
What is intra-abdominal pressure?
So when you breathe, you will have all of your organs should move down, and it changes. Basically, your core is a can or a canister, a piston.
Think of it like round, like a coffee can. That's what I always use. Most people know what that looks like.
Right. And so if you are increasing the pressure with your breathing and or changing the size of the can, then you're getting an increase in pressure. And if you aren't if you're not able to use your muscles in a way that would regulate that, which is part of what your whole core system is meant for, it's actually probably, I would argue, one of the most important parts. Then you can get some of that doming. Did you say anything else when you describe it?
No, not so much. When like Dr. Christina was saying, that maybe it is one of the most important functions of the body, or systems of the, I don't know what you want to call it, of the body or whatnot, but for sure, right, when your intra-abdominal pressure is not correct or balanced, however you want to label it, that's when you can lead to all kinds of stuff happening. In my world, what I see a ton is just the low back giving out, right? They have sciatica or severe low back pain. It's not stabilizing the spine. What maybe do you see?
Oh, pelvic floor dysfunction. So the bottom of that coffee can, so the back of the coffee can is your back. The front of your coffee can is your transverse abdominis.
She should show hers, right? No, we are. That's why there's a drawing.
This is not that type of video.
That's why there's a drawing.
Your deep layer of abs. The top of the can is your diaphragm, which is your main muscle of breathing, and the bottom of the can is your pelvic floor. So what I see is that if you, and what concerns me about diastasis is that if people aren't using the front of their core very well, where is that added pressure going? And a lot of the time it is the pelvic floor, and because we're not super comfortable talking about it, we don't know a lot about it, can go a long time without being addressed. So.
And dysfunction of the pelvic floor, which we've talked about in previous videos, but what's kind of the most common dysfunction of the pelvic floor that you see if maybe their intra-abdominal pressure is off?
Pelvic organ prolapse is the one that we're most worried about. And what happens is that, so you've delivered and now your body's kind of readjusting. You have all this space that you didn't have before kind of in your abdominal cavity, and you're not regulating your pressure well. So you're putting a lot of pressure on the bottom of the can, and your organs don't have the same structural support that they had before. And so your organs, whether that's your bladder or your uterus or your rectum, can sort of kind of cave in a little bit and can ultimately like push down or push through your pelvic floor into
Yeah.
your vaginal canal.
Yeah. Or completely out. Right? Yeah. No fun. That does not sound fun.
So the thing is like you can't necessarily predict it, but what we're doing, why I'm worried about diastasis and why probably you're also worried about diastasis, is just to kind of set yourself up for success in the best way that we know how.
Right, exactly. Well, and we talked a little bit about in the pregnancy video about correctly pushing, right?
Mm-hmm.
So it is 100% normal if you are not practicing diaphragmatic breath during pregnancy that your breath is going to kind of come up into your chest and you become much more of a chest breather because you're running out of room.
Mm-hmm.
And so if you're not actively practicing that postpartumly, your body just needs to be retrained in that, right?
Exactly.
So we both, in treatment of a DR, we both always start with breathing, right? And
100%.
just teaching you how to correctly breathe into the abdominal cavity would be the easiest. I always tell all of my clients and patients that you're not physically pushing, right? The air's going into your lungs. It's just that buildup of pressure and that decrease of pressure. And when you're doing an excellent diaphragmatic breath, you will feel it. You will feel that pelvic floor move. You will feel the whole, not just your tummy breathing, but all the way around. You feel that whole abdominal cavity filling.
Yeah, I kind of call it an umbrella breath because an umbrella opens on all sides.
Yeah, makes sense. Yeah, there you go. Good visual. That's a good visual. An umbrella breath. There you go. Yeah, so first thing we always start with, if you're coming in and you have DR, regardless of maybe if you're having dysfunction that you know of or not, that's where we start.
Right.
Is there anything else in treatment that you'll kind of go to after that, or anything more you want to say on that maybe?
Sure. So ultimately we want to add, so you start with breathing and people are always tired of listening to me talk about breathing. They're like, all right.
Yeah, me too.
Like this thing that I've done my whole life.
It's very important. And I kid you not, once you know a good one, you watch people and you're like, no, they're not doing that. You know, like it's just habit. It really is.
But so the kind of thing that people are kind of excited about getting back to is exercise a lot of the time.
Yeah.
And so we talked about safe exercise during pregnancy last week in our last video.
Yeah.
But there are a lot of the considerations are sort of similar because you want to be able to regulate the pressure. You want to be able to have stability. And so going forward, the way that I check, so there's a lot of stuff online, right? There are people who are being told very similar to pregnancy. If you have DR, don't do anything. And then if you have DR, do all the things.
Yeah.
So there are lots of things that people are telling women who have DR not to do. And a lot of it's ridiculous because if you have a baby, you have to be able to do those activities.
100%. So what it is it's doing those things that maybe if you're not conscious of, like filling the cavity and stuff like that and doing that, you could hurt yourself or make your DR worse or whatnot. But it's really just learning how to use that breath with the movement, which is definitely something we go over a ton in my birth fit class and stuff like that, is just the breath and move or the breath and sit, and all of that. But so definitely I'd say if you are worried about DR and everything like that, we won't go into like all of the different movements and stuff like that might be counterproductive and stuff like that, because it is highly individual,
that's
right?
Exactly what I was gonna say.
Yeah, it's like you might be doing a lot of planks, sit-ups. Those are kind of the movements that you'll hear the most about. People say don't do them. With elevation, I find, especially not sit-ups, I say kind of stay away from sit-ups. There's so much more you can do than a sit-up postpartum to work on your core and stuff. But planks, elevate the planks, and even non-elevated, you might be able to do it properly, right? So it's just somebody getting the eyes and hands on you.
Absolutely.
So for sure,
you can have this huge, right, like this very large diastasis recti and still be very functional and be able to do those exercises. And there can be like really high level exercises that are completely appropriate for you. And you can have a really small diastasis, just maybe in this one spot, and have exercises that are completely not appropriate for you. Right. So that's what I do a lot of, is just modifying activities.
Okay. We can help you, I promise. Yes. So, and there are a ton of different programs online and stuff like that. Honestly, some are great, some are not great. I haven't been able to look at them all because there's so many. So in my expert opinion. I'm sure Dr. Christina will say the same. If you have, or you're worried that you have a DR, get to somebody that can first get their eyes on you, assess it, and then you guys can make a plan together, whether it is in-office treatment, group setting, or an online program. They can help. We can help guide you to the ones that are good. And not every program is one size fits all. If they're claiming that they can fix or heal or whatever they want to say in like minimal amount of time, it might totally work, right? And
for some people it will, but for some people it definitely won't. So just don't get discouraged, and I would caution people. It's so tempting to buy programs like that, because you're just like, I just want this gone, I want this fixed.
And quickly, we all love quick, 100%. I get it.
They're just, if it sounds too good to be true, it often is.
Right, yeah. So if you are pregnant, postpartum, think you have a DR, don't know, come in and see us. Either of us can diagnose it, and either of us, we inter-refer a lot. So if I think you need something that Dr. Christina is great at, I will send you there and she will help you out, and vice versa. So we have one-on-one options, we have group options, we have all kinds of stuff. So by all means, set up a consultation with either of us and we'll guide you in the right direction, or we may even treat you together. You know, that's the great thing of having a chiro and a PT in one office, you know, that it's one-stop shop. So you may need some work that's more than I can give you, and vice versa.
Yeah, absolutely.
Right? Yeah. So anything else at all?
Just one more thing, that if you have a DR and have had a DR for a long time, it's not too late to try and address it.
Yes, 100%.
And if you've had it for a long time and now you're also having things like urinary leakage or pain with sex or anything like that, they could be connected. So definitely
something's falling out that shouldn't be.
Yeah, heaviness in your pelvis, bulging, any of that. Very treatable, doesn't matter how long it's been going on. Still a lot you can do. So
the buzz right around is right immediately postpartum.
Right.
But if postpartum is for life, you know, you could be 60, 70, 80 and you're experiencing that stuff, and there's no reason why Dr. Christina cannot help you put things back together, or what.
It's all muscles. It's just all muscles.
You just have to work at it sometime, right? It doesn't come. Well, I say, like, even the birth fit movements, they appear super easy. When you start doing them, you're like, oh yeah, those muscles were turned off forever. And they are hard, but in the end, once you get them, it is not a hard protocol to follow.
No, and it fits really easily into your life.
Yes, 100%.
Reach out to either and or both of us if you have any questions at all or want any guidance.
Yes. Always can leave stuff in the comments. You can PM us. You can check out Birth Fit West Denver is my Birth Fit page. I kind of keep both of them with the same information, so you can find all of that. I do have a postpartum series starting August. Yeah, probably one in August. April.
I was like, wow,
there is probably one in August. I can't quite remember that far out, but April for sure. So you can sign up for that. It's a 4-week series. We meet twice a week. You can bring your baby along. Dr. Christina will be poking her head in to talk about pelvic floor health and what she sees. So you can always sign up for that. It is a great class, not only to help you rehab from your pregnancy, but to meet mommies too, and just to get to know us too. All right, you guys, have a great rest of your day.
Bye.
Finish.